Hey everyone, welcome back to CareFlow Academy and our NCLEX series. First, let's start with taking a deep breath. And repeat after me. I've got this. I'm prepared. I know more than I think I do. I am ready. Now, before we get started, let's check in with ourselves. Are you in the right headspace to learn? If the answer is yes, then let's begin. In our previous modules, we talked about how to break down any NCLEX questions step by step using our C.A.R.E method. We focused on identifying question types, looking for clues, eliminating wrong answers, and thinking more systematically instead of panicking. Today, we're going to build on that foundation by covering one of the hardest topics on the NCLEX, priority and delegation. And honestly, once you understand the frameworks behind these questions, they become much less intimidating. Let's get started. Priority and delegation questions can be difficult for a lot of students because multiple answers can seem correct. But the NCLEX is not asking, what could you do? It's asking, what is the safest and most appropriate action first? That's a huge difference. Many students struggle with this topic because multiple answers may feel like the right decision. They may overthink the question, or they are not using a system to organize their thinking. That's why we use different strategies like ABCs, stability, and the C.A.R.E method. Priority questions are training you to think like a nurse managing multiple patients at once. You have limited time, multiple responsibilities, and patients with different levels of urgency. Your job is to determine who is the sickest, who is unstable, who needs immediate attention. This is where our priority strategy comes in. The biggest ones you'll use are your ABCs, Maslow's hierarchy of needs, acute versus chronic, and stable versus unstable. This helps organize your thoughts under pressure. Let's walk through our ABCs again: airway, breathing, and circulation. Airway problems are usually the highest priority, then breathing, then circulation. This framework shows up constantly on the NCLEX. Maslow's hierarchy of needs reminds us that physiological needs come before emotional needs. A patient struggling to breathe takes priority over anxiety or emotional distress. Safety and survival always come first. Acute problems are usually more urgent than chronic conditions. A new symptom is often more dangerous than a long-standing stable issue. What the NCLEX is testing you on is how quickly you can recognize deterioration, and if you can prioritize this issue and delegate others. Always ask yourself, who is unstable? Be on the lookout for vital sign changes, sudden symptoms, or signs that the patient is deteriorating. Unstable patients take priority over stable ones almost every time. Remember, these strategies are tools. Not every question will require all four approaches. The key is identifying which strategy actually fits the question being asked. Apply each one only when it is relevant and helpful. For example, if all of the answer choices are interventions or nursing activities, then using ABCs may not really help you differentiate between the options. In that case, another strategy like prioritization, safety, or acute versus chronic may be more useful. The goal is not to force every framework into every question, but to quickly recognize which approach gives you the clearest path to the best answer. Let's go ahead and practice our approach. Which patient should the nurse see first? A patient with heart failure who has 2+ bilateral lower extremity edema. A diabetic patient with a blood glucose of 60. A postoperative patient reporting sudden difficulty swallowing and hoarseness. Or a patient with COPD whose oxygen saturation dropped from 94% to 90%. First, let's assign our ABCs to each choice. The heart failure patient involves circulation. The diabetic patient is currently not affected with their ABCs. The postoperative patient reporting hoarseness and difficulty swallowing involves airway, and the COPD patient involves breathing. Remember, airway comes before breathing, and breathing comes before circulation. Now let's apply stable versus unstable and acute versus chronic. The heart failure edema is chronic and stable. The glucose of 60 is low, but relatively stable. The postoperative patient has an acute airway problem and is unstable. And the COPD patient also has an acute breathing issue and may be unstable. Now let's apply the CARE method. Concept: this is a priority question. Analyze: the glucose of 60 is low but not critically dangerous right now. The edema patient has circulation concerns but no current respiratory compromise. Both the postoperative patient and COPD patient have respiratory issues. But our postoperative patient is showing signs of airway compromise, with difficulty swallowing and voice changes. Rule out: we can eliminate the edema and glucose patients first. Now we compare airway versus breathing. Execute: airway comes before breathing, so the postoperative patient is our priority. Let's try another one. Which patient should the nurse see first? A postoperative patient reporting pain of 8 out of 10 1 hour after receiving pain medication. A patient with blood pressure of 88/54, increasing dizziness and cool, clammy skin. A patient with pneumonia requesting assistance to the restroom. Or a patient scheduled for a dressing change with moderate drainage. Let's label stable versus unstable. The postoperative pain patient is stable. The patient with hypotension, dizziness, and clammy skin is unstable. The pneumonia patient may need assistance, but is not in immediate danger. The dressing change patient is stable. Now let's apply our CARE method to find our answer. Concept: this is another priority question. Analyze: the pain patient has already received intervention. The dressing drainage is not new or alarming. The pneumonia patient may be a fall risk, but the hypotensive patient has dangerous vital signs and signs of poor perfusion. Rule out: the pain and dressing patients can wait. Execute: the patient with hypotension, dizziness, and clammy skin requires immediate attention first. That patient is the priority. A lot of students struggle with priority questions because they feel bad ranking patients. But priority questions aren't asking, which patient do you ignore? They are asking, which patient do you see first? You will still care for all of your patients. You are simply addressing the most immediate risk first. Now let's move into delegation. Delegation is about the right task for the right person at the right time. Always think safety, stability, and scope of practice. The nurse is responsible for assessment, patient teaching, and unstable patients. If a task requires critical thinking, it usually stays with the nurse. Licensed practical nurses typically care for stable patients and routine situations. They often perform routine care, medication administration, and reinforcement of teaching. CNAs focus on routine care tasks. This includes tasks such as hygiene, vital signs, and activities of daily living. These tasks do not require nursing judgment. Never delegate assessment, teaching, or evaluation. Those require nursing judgment and remain the nurse's responsibility. Now let's compare two ways to answer delegation questions. First, using the CARE method. And second, using our never delegate strategy. Which task is appropriate for the nurse to delegate to the CNA? A. Reinforcing discharge teaching for a newly diagnosed diabetic patient. B. Assisting a stable postoperative patient with ambulation. C. Assessing pain 1 hour after medication administration. Or D. Evaluating a patient's response to oxygen therapy. Let's go ahead and break this down step by step. Concept. This is a delegation question. Analyze. Teaching is usually performed by the RN or reinforced by the LPN. Assessment and evaluation require nursing judgment. Ambulation is a routine task appropriate for the CNA. Rule out. Remove any assessment and evaluation choices. Execute. Delegate ambulation to the CNA. Now let's practice by remembering our never delegated tasks. Which patient assignment is most appropriate for the LPN? A. A patient admitted with sudden chest pain. B. A patient requiring initial postoperative assessment. C. A stable patient receiving routine wound care. Or D. A patient experiencing acute respiratory distress. Let's begin by asking ourselves, does this involve assessment, teaching, or evaluation? Chest pain and respiratory distress requires an assessment to dig further into its cause. The initial postoperative assessment states that it requires an assessment. Routine wound care is stable and predictable. That means the stable patient receiving routine wound care is the most appropriate assignment for the LPN. Remember, delegation questions are not asking who you would see first. They are asking, what can safely be delegated? Common delegation mistakes include overthinking, ignoring stability, delegating critical thinking tasks, and forgetting patient safety. The NCLEX rewards safe, systematic thinking, not panic. Keep it simple. Focus on safety, stability, and trusting your reasoning. You know more than you think you do. Delegation can feel uncomfortable at first. Many nurses feel like they are burdening the CNA when delegating tasks. That feeling is normal, but healthcare is a team effort. Everyone has a role, and safe delegation helps the entire team function better. Trust yourself. You know more than you think you do. You've already made it this far. The finish line is closer than you think. Thank you so much for watching Module 3 of CareFlow Academy. In our next module, we're going to tackle Select All That Apply questions and learn how to stop overthinking and think systematically. And remember to take care of yourself. And I'll see you in the next one.